Are you tired of suffering from burning, stinging, tingling nerve pain from diabetic neuropathy or any type of neuropathy? Well, in this video, I will empower you with many effective treatments to put out the fire of neuropathy. Some are low or no cost, so hang with me. Hey everybody, it's Dr. Gaffney from Dr. Gaffney Best Foot here, sharing tips and tricks of what has helped my patients over the years in order to save you time and money in your foot care decisions. Numbness, tingling, burning, stinging, prickly pains in the feet. They're common symptoms associated with peripheral neuropathy. There are many causes of neuropathy, but similar treatments and symptoms. But in this video, I'm going to be focusing mainly on diabetic neuropathy, and that's the most common type of neuropathy according to the foundations of peripheral neuropathy. There's many treatments for diabetic neuropathy that will help other causes of neuropathy as well. So if you don't have diabetes, this video should help you as well. However, if you don't know the cause of your neuropathy, you need to get with your doctor or your neurologist to find out the cause. Many causes of neuropathy are reversible. So in the instance of underactive thyroid or vitamin B12 deficiency, those types of neuropathies can be reversed if you. So what's been disturbing is there's a lot of unknown causes of neuropathy, and I think that has to do a lot with the toxins in our environment and in our foods. And over the last several years, I've been noticing a lot of patients come through my practice that have neuropathy with no known cause, and that's quite disturbing. Anyway, there are many treatment strategies that will help all these types of neuropathies. So an alarming 60 to 70% of diabetics have neuropathy, and it's the leading cause of lower limb amputation is the diabetic neuropathy, which is very disturbing. However, 85% of amputations are preventable according to the ADA, the American Diabetic Association. And we'll discuss how to prevent amputation in this video. And I know it's very scary, the thought of amputation, but the fact that you're watching this video, you're getting educated, you're proactive, those are all important keys to prevention. And I rarely, if any, had any of my patients who were very vigilant and proactive about their neuropathy develop diabetic foot infections. So that is the key, the education, the vigilance, intelligent action steps preventing amputation. So understanding diabetic neuropathy, you need to understand the cause of it. So please try to stick with me through this process so you can understand the whole treatment process. Anyway, what are the risk factors for getting diabetic neuropathy? The longer you have type 2 diabetes, the more likely it is that you can get neuropathy. Also, the higher your hemoglobin A1C, which is a measure of 3-month blood sugar average, the more likely it is that you can get diabetic neuropathy. Also, number 3, increased age. Number 4, smoking, alcohol use, impaired renal function or kidney function, and lastly, metabolic syndrome. And this includes that's associated with insulin resistance of the cells in your body, not accepting the insulin delivering the glucose. And also the metabolic syndrome includes obesity and high blood pressure as well. So in general, the risk factors kind of give you a clue about the cause. But the older you are, the heavier, the worse your blood sugar control, and the more bad habits you have, the more likely it is that you can develop diabetic neuropathy. But if you can control those risk factors, you can lower the intensity of your diabetic neuropathy or possibly not even develop it. So how do nerves get damaged from diabetes? Well, in diabetes, your body doesn't produce enough insulin or possibly no insulin in the case of juvenile onset or type 1 diabetes to regulate the blood sugar, and that starts to elevate in your body. And insulin is a peptide hormone, which is a hormone is a chemical messenger that's responsible for blood sugar regulation in your body. So prolonged high blood sugar is very damaging to nerves. And nerves are very susceptible to high blood sugar, even a little bit out of whack, like people with impaired glucose tolerance or pre-diabetics can develop neuropathy. So essentially, high blood sugar is toxic to nerves. In my career, I've seen many pre-diabetics have numb feet. And that's hard to imagine, but even a little bit out of whack, you can get neuropathy. So even patients with prediabetes or even impaired glucose tolerance can develop nerve damage in the feet. In fact, in a 2011 study by the National Review of Endocrinology by Panoa showed that 25% of patients with prediabetes or impaired glucose tolerance, which is a step down of the prediabetes diagnosis, have neuropathy. So 25% of prediabetics have neuropathy. 21% of those patients have painful neuropathy. 2019 study in the Journal of Metabolic Syndrome and Related Disorders showed that 88% of Americans are in poor metabolic health. So poor metabolic health is a precursor to prediabetes. So this really is a call to action. So to find out if you're pre-diabetic or if you have impaired glucose tolerance, ask your doctor to run a fasting insulin test. Now, fasting insulin in your blood can be elevated about 10 years before you get the diagnosis of prediabetes. So it's a marker of insulin resistance and poor metabolic health. So it's important to find that out early and get all this reversed before you go down the road to diabetes. Now, there are programs being developed to help people prevent diabetes, prevent you from going from pre-diabetic to diabetic. The CDC has recognized that lifestyle is very important in this regard, and there are some diabetes prevention programs that have been developed, one of which is called Fruit Street, and they are soon to be reimbursable by Medicare and some Medicaid programs, even private health insurance. So it's nice that they're finally recognizing that lifestyle is very important. In a study published, patients that participated in the lifestyle change program and lost 5 to 7% of their body weight, only 5 to 7%, added 150 minutes of exercise a week, cut the risk of developing type 2 diabetes by 58%, and 71% of those patients over 60. So Fruit Street's one of those national diabetes prevention programs. There are others. This program addresses all major pillars of health, including diet, exercise, sleep, stress management, cooking, nutrition, emotional support. They have Zoom meetings with dietitians, with other motivated participants, so you have that social support. The cost of the program includes a wireless scale and a Fitbit to track weight loss. There's blood tests. They even deliver medically tailored meals to participants, and I think that part's the most important because that's the hardest to change, is how you eat. So there are many diabetic education programs at local hospital systems that you can look into. The ADA has a resource page that links you up to this, and I will put a link in the description to Fruit Street and the ADA resources to help you get on the right track. So how is excess blood sugar toxic to nerves? Well, it's basically a metabolic train wreck. There are 4 basic causes. The overload of blood sugar can damage small vessels to the nerves, resulting in dysfunction and conduction delay of the nerves. Excess blood sugar in the nerves gets broken down into toxic substances through alternative metabolic pathways. The normal pathway is overloaded, so it goes on these other pathways, and they cause all these toxic substances to be produced that are damaging to nerves, especially the myelin, which is a fat insular layer of the nerve. It's like the insulation. It helps carry the nerve signals better. That part is particularly damaged with these toxic substances. And number 3, the excess blood sugar causes advanced glycation end products. So this is called AGEs, and it attaches to every component of the nerve tissue and leads to toxicity, inflammation, and conduction delay and pain. Number 4, all of these causes of neuropathy cause free radicals or inflammation, and that leads to severe malfunction of the mitochondria in the nerve cell. And this part's important. So it damages the mitochondria, and if you remember, mitochondria is the powerhouse of the cell. So it produces the energy, and if that's not working, the cell dies. So mitochondria is very susceptible to damage from the overload of blood sugar. So why are the feet the most commonly affected in neuropathy? Well, that's because the peripheral nerves to the legs have a very susceptible anatomy. The wire from the nerve goes from the spinal cord where the nerve cell body is. A long little wire goes down to the feet, and the little axon terminals are down there. So the wire from the nerve cell is about 20,000 times longer than the cell body, which is close to the spinal cord. So the length makes it vulnerable to damage. The longest part gets damaged first. So the diabetic neuropathy manifests in 3 different types. The sensory type of neuropathy, which is what most diabetic neuropathy is, the most common. So that's the feeling part where you get the pain from. Motor neuropathy affects the muscles, so you could get drop foot, muscle weakness with this. Motor neuropathy can change the shape of the foot where you get hammer toes and bony prominences. It's not a very common and is more of a later finding. And lastly, autonomic neuropathy. So this is the nerves to the sweat glands, and when that gets disrupted, you can either have really dry skin or really sweaty skin. The autonomic neuropathy also affects heart rate. It can affect your GI tract and blood pressure. So it can make you more susceptible to falls. Diagnosis of diabetic peripheral neuropathy is mainly a clinical diagnosis according to the American Diabetic Association. So the ADA recommends that patients with even pre-diabetes get screened for neuropathy, and clinicians use various tools to diagnose and track progress. So early detection and follow-up of progression of neuropathy is very important to prevent serious problems. An important test in all this is the monofilament test, and that will test if you have loss of protective sensation. So protective sensation basically allows you to feel any penetrating or skin damaging trauma, and your doctor will do this once or twice a year to test for this. But you can purchase your own and test yourself periodically, especially if you're trying to test out different treatments to see if it's helping, like the different supplements that we're going to discuss. So you can have a family member do this for you. I'm going to show you a clip on how to do it.
So this is the monofilament wire. It tests for protective sensation. You just bend it, push it till it bends rather, and check at least 5 spots.
And then your doctor will do a more comprehensive diabetic foot exam. So they'll check vibratory sensation as well as muscle strength, reflexes, and sometimes balance as well. So vibration sensation checks the more insulated or myelinated nerves. So those are the fatty nerves. And usually those are the first ones to lose sensation because the fat around the nerves is very susceptible to the damaging effect of high blood sugar. So once there's a loss of vibratory sensation and there's nothing else, even though neuropathy pain is recommended by the ADA that the patients see their podiatrist at least once a year. So how do we treat diabetic neuropathy? The earlier, the better chance you have to actually reverse the symptoms. The longer it's been present, it's unlikely to be reversed, but it can be well controlled and much easier to manage with these different treatments we're going to be discussing. Please understand there's no magic bullet to treatment. So you normally have to do stacked treatments. Before we get into the treatment, there are a lot of new and effective treatments, but you need to adopt the mindset that symptoms will be improved, but will not be completely eliminated in most cases. There are many hopeful treatments though, however. So in the scientific literature, there is no established treatment except blood sugar control being more effective in type 1 diabetics than type 2, unfortunately. According to the American Academy of Neurology, there's only symptom management of diabetic neuropathy with only 30 to 50% getting symptom relief. However, I have not seen this play out in my practice. I usually, once I start treating patients, normally we get about 70% symptom relief, and that's been getting really creative, stacking the treatments. This disease is complicated, so the treatment must be sophisticated and diverse to be effective, and that's been my experience trying to help patients with this problem. You usually have to do many different things at once to help. Okay. So the way I look at the treatment is there's a 3-pronged approach. So number 1, symptom suppression. So that includes the oral medications, topical medications, and devices. There's disease-modifying treatments, so these have a possibility to reverse neuropathy the earlier they're instituted. And finally, number 3, prevention of complications such as ulceration, infection, limb amputation. Treatments, number 1 is good nutrition, good blood sugar control. Studies show that this is more effective, unfortunately, type 1 than type 2 diabetics, but I've seen blood sugar control help markedly in my type 2 diabetics, especially with the intensity of the neuropathy. So what this is basically you're not putting more gasoline on the fire, more blood sugar damaging the nerves. So that's what you have to think of when you think of the blood sugar. It's just gas on the fire of neuropathy. In 2018 by Shabasi and Diabetes Care is more hope for blood sugar control, and they did data from 2 sets of people of uncontrolled diabetes and neuropathy type 2 diabetes, and they demonstrated improvement in several measures of neuropathy with improvements of hemoglobin A1C to near normal after 2 years. So you guys stick with it. It's a long process to heal these nerves. So in theory, reduction in blood sugar to more normal levels will reduce inflammation, oxidative stress, those advanced glycation end products. So there'll be less toxicity going through those alternative pathways, and in turn, less damage. So blood sugar control and nutrition, very important. Get with your diabetes educators at your local hospitals. Get in one of these programs and get that dialed in. So number 2 disease-modifying treatment is exercise, and this is low, no cost, and I know this one's a hard one, but it's extremely effective, and I'll show you why. So studies have shown that exercise increases epidermal nerve fiber density, that's nerves in the skin, and decreases neuropathic pain. So actually you can regrow your nerves in your skin by exercising, and it also decreases the pain. So this is really, really important. It can reverse neuropathy to a certain degree. So anyway, in Journal of Diabetes Complication by Balducci had mentioned this, as well as a couple other studies. Exercise, especially resistance training to build muscle, will increase your mitochondria that we were talking about, that it get affected with the high blood sugar in nerve cells and get damaged and kill nerve cells. So resistance training increases your muscles, and that'll increase your mitochondria, the powerhouse in the cells. And that's targeted in the neuropathy pathogenesis. So in theory, it can combat this process. So work with your doctor, get on those diabetes education programs, get with the physical therapist, establish a good exercise program. Just be careful. You have to work with your healthcare providers in this regard, because people with diabetes have other medical problems like heart disease. And so you have to consult your doctor before starting any exercise program. And also you have to get with the trainer so you don't hurt yourself too. So for diabetics, the American Diabetic Association has tremendous resources of programs to help diabetics with neuropathy in exercise, diet and exercise programs. One of the programs online is called Good Measures, and I'll put a link in the description. And your local hospital system, like I said, has support programs as well. So another potentially disease-modifying treatment are supplements. And according to this systemic review from the International Journal of Diabetes Research in 2013, showed that many nutrients may be helpful in preventing or partially reversing the effects of diabetic neuropathy. So there's many involved here. I'm going to talk about just 3 of them. Acetyl l-carnitine supplementation, there's been a lot of research on that. It's actually an amino acid that helps with fatty acid metabolism. So with acetyl l-carnitine, there's one large study in Diabetes Care in 2005 where over 1,200 patients were treated with diabetic neuropathy using 1,500 to 3,000 milligrams of acetyl l-carnitine daily for a year. So they saw that patients taking 3,000 milligrams of the acetyl l-carnitine had significantly less pain in their extremities, had better vibratory sensitivity in their fingers and toes. So that showed that acetyl l-carnitine may be helpful for nerve regeneration. You can take 1,000 milligrams and it can be helpful, and the cost for this is anywhere from $56 to $72 a month. So the next supplement is alpha lipoic acid. This is an antioxidant shown to lower inflammation in your body. In the Sydney 2 trial, patients taking 600 milligrams once daily of alpha lipoic acid had changed from baseline of total neuropathy symptom score decreased by 51%. So in this Sydney 2 trial, they found that taking 600 milligrams of alpha lipoic acid once a daily had the optimum risk to benefit ratio, and this costs around $62 to $72 a month. Okay, so the next supplement that has disease-modifying potential is Metnex, and this is bioavailable forms of vitamin B9, B12, and B6. So That just means that they're partially broken down in this medical food called Metnex, where you can absorb it much better in your nerves. So, in a study of 123 patients in the Journal of Diabetes 2016, these patients had absent monofilament testing, so absent protective sensation. And it was shown that after they take it for 6 months, there was a 60% increase in intact sensation. So the patients had sensation improvement, had an increase in epidermal nerve fiber density, so more nerves in the skin. So that is awesome. You get more nerve endings in the skin so you can feel more. Another study on Metnex and type 2 diabetes with peripheral neuropathy, this was in the Journal of Medicine by Finesca, showed that 214 patients took the Metnex for 24 weeks, and results showed clinically significant improvements in neuropathy total symptom scores at week 16 and week 24. So quality of life improved. So you got to take it for a long period of time. So the cost of Metnex is $66 a month. You get it from brand direct, and it's considered a medical food, so not exactly a supplement, not exactly prescriptions, but it needs to be prescribed by your doctor. So if I had diabetic neuropathy, I'd probably take one of these supplements just to see how they work, and I'd be testing my protective sensation with the monofilament wire. I'd have one of my family members just test me to see how well this would be working, like every 3 months. So downside to these supplements, they take a long time to help, like several months up to a year, because nerves take a long time to heal. And sometimes, unfortunately, they might not help at all. You don't know it until a year later. So it could be a waste of money. You just don't know, but it could be an awesome return on your investment. You can see from the studies that it helps a lot of people. Another downside is insurance does not cover the cost of supplements. Supplements are not regulated by the FDA, so you have to research the company manufacturing the supplements to make sure that they have good manufacturing practices certified, and that manufacturing process is regulated by the FDA. You gotta make sure that the supplement company has third-party testing for purity. There's 2 companies I trust and use, and they're Thorne and Pure Encapsulations. I will link to these in the descriptions as well as the particular supplements. And like I said, Metnex has to be prescribed through your doctor. Okay, the second treatment approach, symptom suppression. And we'll discuss the American Academy of Neurology treatment guidelines. And you kind of have to get your mind right when we go through all this. In the American Academy of Neurology, they say the goal is to reduce but not eliminate pain. And 30% reduction in pain was considered a success in clinical trials. However, in my clinical practice, I have seen much better success of these medications when combined with other treatments. And I was surprised to read 30% success rate because I've seen it much better in my practice. So for painful neuropathy, the American Academy of Neurology recommends 4 classes of drugs that have been shown to have pain reduction in meta-analysis. And those are just a bunch of studies in a bigger study. So these drug classes are either antidepressants or anti-seizure medications. So they act on nerve tissue, either a central nervous system or peripheral nervous system. So there are only a few of these medications that are FDA approved for diabetic neuropathy. The rest are used off-label, and I'll discuss which ones. I'm also going to just talk about the most common medications used for diabetic neuropathy, but please know that there are other medications that can be tried that you can talk to your doctor about. So the first class of drugs is called gabapentinoids. Most everyone probably knows about these if you have neuropathy. So these are anticonvulsants, anti-seizure medications, and they're most commonly used in diabetic neuropathy. Gabapentin or Neurontin is the one of the most common medications, but it's not FDA approved to treat diabetic neuropathy. Pregabalin or Lyrica is FDA approved to treat diabetic neuropathy since 2005. It's the preferred treatment for diabetic painful peripheral neuropathy by the American Academy of Neurology. Both these medications, gabapentin and Lyrica, they require what's called titration. So you have to start off in a low dose and slowly increase it over time, especially in older people, and the elderly are very, very sensitive to this medication. So you got to start off low dose and kind of tolerate that for a while. It probably won't help your symptoms as much, and then you have to slowly increase it. And in time, it'll help your symptoms, and the slower you institute it, then the less chance of side effects, and that's why. So the side effects are the main reason why these medications fail. They include edema in your legs, swelling in your legs, dizziness, lethargy, confusion. Some of my patients would tell me they feel drunk on these medicines. Also, you got to use it with caution if you have heart disease, kidney disease, or liver disease. So it has to be a conversation with your doctor if this will be safe for you. So in my experience, though, Lyric and gabapentin has helped about 80% of my patients. I've put it on. I've had to take a lot of patients off of it due to the side effects. So the second class of drugs is called serotonin norepinephrine reuptake inhibitors. So that's a mouthful, but those are antidepressants. So in this class is Cymbalta. And Cymbalta is another FDA-approved medication for diabetic neuropathy since 2004. It treats fibromyalgia and depression, and also effexors in this category. The other classes of drugs, there's tricyclic antidepressants and also sodium channel blockers. Recommendations from the American Academy of Neurology treatment guidelines, they strongly discourage opioids or pain medication due to weak, non-existent long-term efficacy and severe long-term consequences. They don't recommend opioids for treatment of diabetic neuropathy. They also recommend a series of medications that may be needed to identify the treatment that most benefits the patient. So the American Academy of Neurology says that it takes about 4 to 16 weeks of taking a medication to determine its effectiveness. If there's no significant pain reduction, or there's intolerance or side effects outweigh the benefits, if there's failure or partial improvement of one drug within a drug class, so you got to do that over several weeks, then one should try another drug class if that happens. So there's 17 medications in total, just about between all these drug classes. So there's many opportunity to find a drug that would help your diabetic neuropathy. So what all this means is that you have to stick with the medication for a period of time to see if it works, probably around 12 weeks. And so around during that time, unless it's intolerable or the side effects outweigh the benefits, or if it's not working, then after this, try a different medication. But so the take-home point is keep working with your doctor. Don't give up on it too soon. Okay, so topical medications. This is one of my favorite ways to treat diabetic neuropathy. You can use Lidoderm or lidocaine patches. They're over the counter. In my experience, I have found lidocaine patches to be extremely helpful for nighttime neuropathy pain. They're a good little hack to use if you have burning foot pain at night and you can't get to bed. I just have my patients cut a patch in half and put it on the top and on the bottom at the midfoot before bed. You can leave it on for 12 hours. Got to take it off for 12 hours. There's very little downside other than the possibility that might not help you. And of course, if you have an allergy to adhesive, you shouldn't use it. Another topical would be compounded cream. So compounded cream is produced by a compounding pharmacy who takes the medications and compounds it into a topical cream, and the medication is absorbed through the skin. There are not many scientific studies supporting the efficacy of topical compounded cream in diabetic neuropathy. It's hard to study because there's multiple medications being used at one time. Even though I couldn't find many studies to support it, I do love using compounded cream. And in my practice, I've found that it has helped out 90-95% of patients with painful diabetic neuropathy, especially when there's gabapentin in the compounded cream. So in my experience, I've found compounded cream to be very helpful in mainly older patients, but anybody, it's so helpful. Okay, so the next symptom suppression type treatment are devices for diabetic peripheral neuropathy. Spinal cord stimulators are very helpful. FDA approved for diabetic neuropathy in 2022 is the Medtronic spinal cord stimulator. Studies show that 70% of patients experience pain relief with spinal cord stimulators. Okay, the downside to it's a minor surgery that you need a neurosurgeon for. However, when medications aren't working, I found that spinal cord stimulators have helped many of my patients. The spinal cord stimulator, like I said, it's a surgery, so you have to have optimal blood sugar control and be cleared by your physician to have that type of surgery. they put in a trial device, and if that works, and they put in a more permanent device. So it's basically sends out these signals that kind of compete with the pain signals so they don't go up the spinal cord to your brain. Okay, the next symptom suppression device is low-level laser. It's FDA approved for temporary relief of chronic nociceptive, or means pain, of musculoskeletal pain since 2019. It reduces inflammation while promoting biostimulation at the cellular level. So I can only find a small study of 20 patients for 24 weeks showing reduction in neuropathy pain, increased quality of life with deep tissue laser, which is increased wavelength penetrating deeper to stimulate and regenerate nerve cells. It could be considered disease modifying, but more information and studies are needed to determine if it can affect patients with diabetic neuropathy. But it's interesting and shows promise, so stay tuned. But I think with any of these types of devices I'll talk about, you'll probably need to reuse them periodically because you'll still have diabetes, so you'll still have that excessive blood sugar damaging the nerves. So because of lack of scientific validation for laser, just be careful spending large amounts of money for laser treatment for diabetic neuropathy because insurance isn't going to cover it at this point in time. So the next device is a TENS unit, which stands for transcutaneous electrical stimulation. This works sort of like a spinal cord stimulator, but locally on the extremity, not as strong, and it competes with the pain signals via low voltage electrical stimulation to crowd out the pain signals. So it's low cost and may be helpful. You can use it adjunctively with the other treatments, and the long-term efficacy is unclear, unfortunately. It can be bought on Amazon. I'll link to it in the description. So another device that can be found in doctor's offices, certain doctor's offices, to help with diabetic neuropathy is called neurogenx. So neurogenx is a combination electrochemical therapy. It uses gentle wide frequency electronic signal to increase cellular metabolism, which we know gets messed up with the mitochondrial damage within the nerve cell. So this removes the excess fluid and waste products out of the nerve and increases blood supply. So that's one of the reasons why I like that, is it increases blood supply and it increases cellular healing. It's reported there's an 87% reduction in neuropathy symptoms, 87% reduction in neuropathy symptoms. That is awesome. Without medication, another awesome point. It is claimed that it can provide relief to patients who are resistant to conventional treatments. So that's another big positive. This is another big one. There's a reported whopping 165% increase in nerve fiber density. So it's basically regenerating those nerves and increasing blood flow. So that is awesome. But the downside, of course, it's not covered by insurance at this time. So it does take up to 24 sessions, 1 to 2 visits a week for 4 to 6 weeks. The sessions last about 20 to 40 minutes, and it costs anywhere from $600 to $1,200 in total. You can go to neurogenx.com to find a provider who does this. I'll put a link in the description. So, this treatment would probably need to be repeated because you still have the diagnosis of diabetes, so that you still have ongoing nerve damage to a certain extent. So you probably would need this from time to time. Lastly, there's a device called a pulsed electromagnetic field, or PEMF. And it comes in a mat. It works also via cellular biostimulation to activate self-healing. It has been shown in scientific studies to significantly reduce neuropathic pain and decrease the progression of neuropathy, as well as increase microcirculation. So probably the kind of similar things as the neurogenx. And I will link up to those articles in the show notes. You can work with your doctor to get one at home. They cost around $200 to $300, but also there's different physicians that do this therapy. And I would recommend having it done by a physician. So it's safe and effective, but again, not covered by insurance. So the cost in a doctor's office is about $30 to $60 for 30-minute session. It's recommended to do it for about 4 to 8 weeks. Again, it's likely this will need to be repeated from time to time because this diabetes is still present. And talk to your doctor about starting the PEMF. With all these treatments, you got to work with your doctor. Don't just try these things by yourself, but really work with your doctor and your healthcare team to make sure that you're doing things right. The last part of diabetic neuropathy treatment is prevention of complications and the action steps that you need to do this. This is a very important part of preventing ulcerations, infections, and amputation. This requires a team of healthcare providers, and it's very important. It involves maintaining all your doctor appointments and daily vigilance of your feet. So this will include visual inspection. I recommend applying moisturizing cream to your feet daily. Diabetic neuropathy affects the sweat gland, so you can get dryness or actually a really sweaty feet as well, but it's either or. So if you have dry skin, my favorite lotions are Gold Bond Diabetic Cream, CeraVe, as well as there's a newer cream for diabetics from Skin Integra called Dry Crack Cream. That works awesome. Be sure to be checking in between your toes and for cracks on your heels. Small things can turn disastrous, and I've seen cracks on toes and heels turn into amputations. So be sure to check there. This is important. Seek care as soon as a problem is detected, and that'll prevent infection and amputation. Make sure that before you put on your shoes, you feel inside there to make sure that there's no defects in the skin, the shoe liner, or folds in there that can cause pressure. If that's there, then throw it away, because those can cause blisters and those types of things. Also, shake out your shoes before you put them on, because stuff gets down in there. I've pulled out so many things from shoes, like jewelry, paper clips. I've had a medicine cup. Somebody had a medicine cup shoved down in there. Don't use a heating pad on the foot. Don't soak in hot water. Don't put your feet in ice. Wear clean socks every day around the house. Wear at least a rubber-soled slipper that's well-fitting with the appropriate toe box. Avoid tapered toe box shoes that squeeze your toes together. Try to get an anatomical toe box type shoe like a Bronax or an Ultra sneaker. Work with your physician, physical therapist, health coach, and participate in the diabetes management education programs for optimal blood sugar control, exercise plan, the anti-inflammatory diet that we talked about. You need to be able to adhere to it and to sustain it. Have the physical therapist assess if you need any assistive devices to help with falls. And be vigilant about any swelling or bruising in your feet. If you have numbness, you might not be able to feel when you fracture a bone in your foot. And I've seen this in patients in the past. They come in with swelling and bruising. We take an x-ray and they have a fracture. So any swelling or bruising, get that checked out. Discuss with your doctor if diabetic shoes are needed. Stop smoking, limit your alcohol use, or better yet, stop alcohol use. Discuss with your physician about going on various supplements, topical treatments, oral medications. Supplements, like we talked about, unfortunately are not covered by insurance. They take about 6 to 12 weeks to know if they're helping you. I would suggest doing one supplement at a time to see if it's helpful, instead of going on all three at once that we discussed about. The best hope, I think, to help with diabetic neuropathy, decrease your symptoms, and live better is stacking these treatments. You start first with diet and exercise with the diabetic education program. Work with those people in those programs to dial in your diet and your exercise. We've seen that that has helped neuropathy patients a lot. You want to go on the oral and topical medications to control your symptoms if you need it. If that's not helping enough, you can try one of those devices that we talked about, the neurogenx or the PEMF mats, which have been helping patients a lot. And lastly, if none of that is doing the job, you have the spinal cord stimulator if you are optimized with your blood sugar control and you're cleared by your doctor to have that minor surgery. So there's many, many treatments to help you. You just have to work with your doctor and you'll find the right treatment program for you. If this has helped you and you got value out of this, please like and subscribe to my channel. I'd appreciate that very much. If you want a PDF copy of the foot health tips for patients with diabetes, please subscribe to my newsletter at drgaffneybestfoot.com. And thanks again, and we will see you next time.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.